At one point of time, a couple of years ago, this picture was a craze. It was on the TV and everybody knew about it, but I think we have all forgotten about it. Right? So this was the 7 billionth baby which was born in India. And it was on the front of all newspapers, including Statesman and Times of India. Of course, now we have gone much beyond 7 billion. And why I am showing you this picture, there is a reason for that. That shows the way occupational health and the occupational health risks are developing in our country. That means our population is increasing. 7 billion babies here, so AIDS will also be here. There are so many, the way our population is increasing. We are a young country. In many countries, the population has started declining, including China. But India is one of the few countries where it is still exploding. Second, Nargis is female. That means there is an increasing prevalence now of females in the workforce. Not only in the population, but also in the workforce. And therefore, problems which are faced by women are going to assume more and more importance. So, when we talk of occupational health problems in our country, this occupational lung diseases like silicosis, anthracosis, asbestosis, bisonosis and all, they still are at the top. Then there are other occupational lung diseases also. Pesticide exposure in agriculture workers, because still more than 50% of workforce in our country is engaged in agriculture. Of course, it has come down from 80% to 52%, but still 52% remains very high. They are all exposed to various pesticides. In your occupational injuries, psychosocial problems, chemicals, musculoskeletal disorders is very top. Actually, it should have come much before that, because in every occupation you are facing that. Then there is inadequate ventilation, dermatosis, and hazards in mines and all. They are also there. And new pathologies are now coming up, whether it is AIDS, stress, geriatrics, pest medicine, as we say. As more people start traveling by air, there will be problems related to that. And migrant global workers, because now people are migrating. People are coming from smaller villages to bigger towns, from towns to cities, and from cities to intra-country, they are all migrating. And with that, there are different problems, because they would not be covered, they would not have proper insurance coverage, and it is a short-term floating population, so not much care will be taken about it, but that is our working population, so it affects the productivity that we have. Now, so therefore we need to have occupational health services, and these are the various elements, how it is managed, medical treatment wherein you all can help, then assessment and control of work environment. Because treatment is after the problem takes place, and as I said, that there is no cure for occupational diseases, so therefore they need to be controlled, and that can happen only in work environment. We have to also take general preventive health measures, including enlightening them and educating them, so that they prevent it, and preventive medical examination. So these are the various measures which can be taken: administrative, engineering, ergonomics, and medical measures. I will just touch very briefly on ergonomics, not much in details because you all know it very well.